Again, I'm Pam Wycliffe. Anyway, I need to say a few words that we always say at the beginning. And I think all of us have probably heard them many times, but I'm going to do them again. We never support the league never supports or opposes a political party. We are nonpartisan. What we do is we do voter services and citizen education, presenting an unbiased, nonpartisan information about elections, the voting process, and issues. And if there are issues after we study them, because we do studies about particular issues, and after the study, we will take a position to advocate for or against particular policies of public interest. Today, because we are nonpartisan, the comments or opinions you might hear from people today are not those necessarily of the league. We'll be here from noon till 1, actually a little after noon. And the format generally, and I don't know, I didn't check with you, Heidi, is generally for you to speak for the first half hour and then question and answers in the second half. Is that okay with you?
Yeah.
Okay. So if everybody would please mute themselves. And if you have questions or if you have comments, please put them in the chat. And then either I can read them to you, Heidi, or you can read them yourself, whichever you prefer.
Okay.
But we'll keep track. I'll keep track of them. And for more information about being, if you'd like to know more about being a member of the league, you can go to wlvsouthbend.org. And not only will it have information about what we locally do, but also it'll give you a link to the state League of Women Voters and also to the national. And you can find out all the stuff that we do. And because this is registration season and voting season, you can also check out vote411.org.com. Elizabeth Benyon just joined, so she'll tell me if I'm wrong. And it has information about everything you want to know about your candidates, about voting, about where your precincts are, about how to check your registration to make sure that you're still registered. You can register to vote on there. I mean, it has a lot of information on there, and it's put out by the League of Women Voters. Okay, because they were going to, and that is about our little blurb. There is some news that I need to talk about, and one is that there was going to be a new member party on October the 21st, but it had to be postponed, so it's going to be in the spring instead. So if you're a new member and you want to get involved, it is .org. That's, yeah, thank you, Elizabeth. And you want to get involved, just get online, either on Facebook or on our website, and there are places to get involved. Vote 411 is now, they're working hard to produce that. So before the municipal election, there'll be all the information about the candidates. And so that you'll have everything you know to make an informed decision. Okay, and the other thing is they had a candidate forum on the 5th, and it is on the League of Women Voters page. So you can go and look and see what the candidates had to say that night. And there is not one for a mayoral candidate. That has not been, there's not one scheduled. And I'm not sure there's going to be one, but we'll find out. But you can still learn about them at vote411.org. You can also watch the candidates' editorial board interviews and watch the candidates' WNIT Politically Speaking primary candidate interviews. And then spread the word. There's also on the 21st of October at 2:00 at the Center Township Branch Library on Kern Road. They're going to do a voter education series, a hands-on workshop to view the process of voting, get your questions answered, and vote for yourself in a mock election. And now I would like to introduce our speaker. Whoops, after I let this person in there. Heidi Bettinger Burnett is an associate professor of the practice at the Institute for Global Health, University of Notre Dame. With a master's in public health from the University of Illinois, Chicago, and a PhD in educational leadership and organizational analysis from Western Michigan University, Heidi has developed a broad background in public health, policy, community-based research, and leadership. She undertook various leadership roles with the Centers of Disease Control and Prevention for 13 years. And at Notre Dame, she focuses her research on public health, and policy by developing partnerships with communities, organizations, and governments in St. Joe County and throughout Indiana. Most recently, her research has focused, on lead poisoning prevention. Heidi has co-founded the Notre Dame Lead Innovation Team and the St. Joe County Lead Affinity Group Community Coalition. Her research has found that over 75% of pre-1950 homes screened for lead in St. Joe County were found to have at least one lead hazard. And what those findings have led to is lead screening kits, the development of a lead screening kit. And this being National Lead Poisoning Prevention Week, which is October 20th to the 22nd to the 28th, we're ahead of the game because we're going to have Heidi speak to us today. And Heidi, welcome and thank you for coming.
Awesome. Thank you, Pam, for having me. Thanks to all of you guys for attending today's talk about lead poisoning prevention. I'm going to take you through several slides and give you some history about what we've been doing about lead poisoning prevention here in St. Joseph County. And the truth of the matter is that we've created a fantastic foundation for lead poisoning prevention in St. Joseph County. What we haven't done is we haven't hit that tipping point where we're reaching our target population, which means that we needed to take a step back and look at what we were doing in terms of communication and awareness. And so our Lead Affinity Group has committed to doing 35 community presentations between now and the holidays in December. And so this is part of our commitment to our community in terms of raising awareness and communicating about lead poisoning. All right, there we go. So this was the headline in February of 2017 on our South Bend Tribune, and that is a picture of Atticus, who's 2 years old. I met Atticus and his mom after this came out, and what this article did was put a huge spotlight on South Bend, in particular Census Tract 6, which is the near northwest neighborhood, where children were testing positive for lead at 6 times the rate as compared to Flint, Michigan. And in 2017, this was a 5 alarm because Flint was still right there in our headlines and we were all talking about Flint. But for an article to come out and now say that we had a neighborhood here in South Bend that was 6 times the rate of Flint, Michigan was alarming. And it sounded the alarms. And the health officer at the time at the health department said to me, I was serving on the Board of Health, that he had literally one full-time employee that was paying attention to lead poisoning prevention for St. Joseph County and had no other resources to allocate. That's how this whole thing kicked off. That's how the whole thing kicked off. That health officer says to me, you work at Notre Dame, surely you guys have resources. And I was like, oh my God, that the magnitude of this problem was just something else. By the way, Atticus is 2 years old in that picture. And when he was 1, he had stopped forming words. He had already been up on his feet and was like crawling along windowsills and furniture and had returned to crawling. And it took his mom a year of doctor's visits to find out that her son had been lead poisoned, a whole year. So that tells you how unaware we are about lead poisoning and what lead poisoning can do to us. So what ended up happening to Atticus and his mom is that literally their lives fell apart. Her husband left because because it's such a difficult situation. She ended up losing her home because she couldn't afford the home by herself, and then she left everything in her job and moved back to North Carolina to move in with her mom and dad. So this on the left hand side, you can see this is what people were, if you were working in the lead space, this is what it looked like. It was just a spider web of who knows what, right? We were operating in silos, and some were talking to each other and others weren't. Post 2017, and after 2 community town hall meetings, which were attended by around 70 community members, we created the Lead Affinity Group. That's our community coalition established in 2017 that is all things lead poisoning prevention related. So we now have a hub. We now have people who are meeting once a month regularly since 2017 to discuss lead poisoning prevention. Here are our partners. I'm sure these are all names that are very familiar to you, and we're always looking for more. So if you know of groups, organizations, and so forth, we're always looking for more partners. So you might ask yourself, well, what the heck, has this community coalition been doing for the last 6 or so years? Very quickly, we identified we're a community coalition of volunteers, right? So we're all doing this in addition to full-time jobs. We've decided to focus on advocacy and leadership. And here's what advocacy and leadership has brought about for our community. On the left-hand side, you will see there's new funding. This is new funding. This is not the existing funding at the health department or the existing funding like a code enforcement for the city of South Bend, but this is brand new funding that was brought into our city, which is almost $9 million. And then we advocated for new policies. We can bring in funding, but if we don't change the policy and change the way that we do things, we're not going to build sustainability. And so we then ended up changing a number of policies. And I'm also pleased to report, and I'll tell you this later, is that there are also new 2 policies at the statewide level. So I'm thinking that most of you are familiar with lead because you can remember this from your chemistry class. Lead is a blue-gray metal that occurs naturally in the Earth's crust. And the really difficult thing about lead is that, first of all, there is no safe level of lead. It is virtually toxic to every single organ in our body. So it has no earthly reason to ever be inside of a child's body, our bodies, right? The flip side of that is that lead is an incredibly useful element. It is useful. It's used in batteries. It helps paint dry. It helps paint last. It helps cars run better. So this has been this dichotomy, for all of these years. Gosh, it's super helpful, but oh my gosh, hello, it's also incredibly toxic. Like we can't continue to do this. On the lower right-hand side, I include this little bit of history that there's a theory that it is lead poisoning that led to the downfall of the Roman Empire. The Romans had used lead in the creation of their dishes and their vessels in which they would drink water and wine from. They also added lead acetate to their wine as a preservative and a sweetener. When they poured that wine into a vessel that had lead in it, not only were they getting lead through the wine, but that wine was leaching the lead from the vessel. And so they were getting it twice. And so there's a theory that the Romans actually poisoned themselves to death and out of existence. So where does lead come from? For us, it's the legacy of leaded paint and leaded gasoline. And it took us a really long time to ban these things. The League of Nations in the 1920s banned lead in paint in Europe. And it took us a full 50 years later, which just tells you, again, we've heard this time and time again, right? Tobacco is another company, an industry that knew that it was causing problems, and it takes decades before we can overcome those kinds of things. And we're still dealing with this issue. So where is lead found today? So you're not going to go to the hardware store and find it in a gallon of paint anymore. And you're not going to go to the gas station. You won't find it in your gasoline there, which is the way it should be. But what's happened is then over time, that lead has broken down and now it exists in our environment and it exists in the soil. It exists, it is the old chipping paint on the older homes that were built before 1978. We still have lead pipes. Dust is created, leaded dust is created when the paint around window frames and around a door jamb, when things are going up and down or opening and closing, we're creating friction, and that paint is breaking down into fine particulates. And where does it go? It falls down to the ground. And who's on the ground in the houses? The little kiddos who are scurrying around and crawling and learning to walk. And this is how they're ingesting the lead. So how does lead affect the body? As I already said, the lead has absolutely no earthly reason to be in our bodies. Everybody should have 0 lead in their bodies. And that is not what's happening because we have not been paying attention to this problem the way that we need to. The lead poisoning is much more significant for young children as compared to adults for a variety of reasons. But number one is because their development is so rapid. The metabolism is so much faster than adults. So the absorption of lead is faster and more efficient than it is for adults. When a child is lead poisoned, initially you won't realize what's happening. There may be no symptoms. The symptoms may really be mild, and the symptoms also mimic ADHD or hyperactivity. So oftentimes people are looking for medication to solve that problem, and in fact, that won't make any difference. It's because it's coming from the lead, which you need to do something completely different in that regard. So a child can look like they're having hyperactivity and ADHD, but this leads to higher dropout rates because of the concentration problems and cognitive problems that are happening. So higher dropout rates, lower lifetime earnings, and the worst of them all is that they have higher criminality rates. They are more likely to be in prison than people who were not lead poisoned. So what do we do to prevent lead exposure? There's actually a lot of very practical things that we can be doing and teaching each other. If you are living in a home before 1978, these are the things that you need to be thinking about. Number one, on the left-hand side, there is nutrition. A full belly, a healthy full belly is less likely to absorb the lead than a belly that is empty and poorly fed, poor nutrition. So we have to be thinking about good nutrition. The next one is remove your shoes. Because if you're walking from the garage or from the street to the house and you cross some exposed soil and there's lead in there, you have the chance of picking up that lead and bringing it into your home. The third one there at the top of the clock is get your home tested. This is where our lead screening kit comes in, and I'll talk to you about that in a moment. The next one is cleaning. This is a really, really important one, and most of us hate dusting our homes. But if you live in a home before 1978, you need to be doing damp horizontal cleaning once a week. And it's super simple. It doesn't require a cleaner. It doesn't require a special soap or a special rag. Literally, it can just be a cotton t-shirt that's been cut up, and you dampen that and you go around and you wipe down your horizontal surfaces because that's where the dust rests. And then finally, in that lower right-hand corner, it's washing hands. Kiddos especially need to be washing hands before every meal. And so what do we do with the lead paint? So this is an actual picture from the city of South Bend. The contractor who was working on this house actually sprayed the words lead paint on there to make sure that everybody knew that there was lead paint there and to use safe practices when removing that paint. Under no circumstances should a home that is built before 1978 use anything close to sanding. You have to scrape off paint, and you have to actually wet down the house while you are doing that work, because otherwise it aerosolizes and it can actually contaminate the house next to you. And we actually have an example of that happening where somebody was sanding the outside of the home and it actually poisoned the children next door. And that happened right here in South Bend. So who's at risk? So it's children who are under 7. So this is a map of really of downtown South Bend. And as you can see, as the colors intensify, this is where their children are testing positive at the highest of levels. So census tract 6, you see that triangle piece there to the left of Memorial Hospital. That's the NNN, the near Northwest neighborhood, where children were testing positive 6 times the rate of Flint. Kiddos are testing positive, that 1 out of 3 children are testing positive for lead in that area. 1 out of 3. The red ones represent anybody that of 20% rate. 1 out of 5 kiddos are testing positive. So my point in not only do I want you to know like the distribution and what it looks like, but to also realize just how significant a problem this is and how widespread. And while it does affect minority populations at a higher rate, it is also grounded in low income because it is tied to housing, right? If you are a family of low income and you need to look at the quality of the home, it's when houses are built before 1978 and are in disrepair that children are at risk of getting lead poisoned. So very exciting, switching gears here a bit. Indiana, the state of Indiana has been out of compliance with CDC guidelines around lead poisoning prevention for over a decade. So when we were putting our community coalition together, our Lead Affinity Group, I learned that there was a statewide coalition that was being put together. And so I joined that statewide coalition about 6 years ago. And we have been working on this proposal, actually the 2 of them, for 6 years. And in the last session at the State House, they finally passed these laws. And so what this law now says, and we're in compliance now with CDC, is that providers have to verify that 1 and 2-year-olds are being tested for lead. And if they have not been tested for lead, it is the provider's responsibility to make sure that they are tested for lead. So what's going to be the impact of this? Well, let me move that little bar there. The impact of this is that there are roughly 4,000 births in St. Joe County each year. So that means if we meet the goal at 100%, which that's what we aspire to, then we should be doing around 8,000 tests a year. And currently we are doing around 3,000. So we've got a ways to go. This is the second law, and this is really important. So this is about case management. So when a child is identified to be lead poisoned at a certain level, that's when the system activates and brings about case management, which is twofold. One, it's about nursing, right? Handling the medical side, making sure that the child, the blood lead level is dropping, right? So that they're being managed properly. Mom and dad understand what's happening, best practices around making sure they're taking care of their home. And then there's the second part of it, and that's when Environmental Health Services comes out with a machine, an XRF, and finds where the lead sources are in the home, right? And then helps mom and dad think about mitigating and getting rid of that source of lead. And again, just as I said in the last slide about what the impact is, we're expecting a 4-fold increase in the number of children who are going to need to be case managed. This is significant. This is significant. And we need to be talking to our schools about this because these kiddos are sitting in classrooms right now who have tested. They have not yet been tested, but they are positive for lead and they don't know it. So the Lead Affinity Group, one of our reasons for being is figuring out how do we collaborate and communicate with each other better. And so we have come together, the lead poisoning prevention programs and resources for St. Joe County. These are the 3 main bodies who are providing services. So we've got the St. Joseph County Department of Health. They provide the state mandated things, case management, nursing, testing of the homes. The city of South Bend came on a couple of years ago, and they are now doing free water testing for their residents. And they will also They also have a HUD grant, Housing Urban and Development Grant, where income eligible families can apply to get dollars to repair and remediate their homes. And then finally, us at Notre Dame, the Notre Dame Lead Innovation team. What we found is that there's a huge barrier to getting your home tested. You have to, you have to reach out to somebody to have them come with this expensive machine that costs $25,000. It usually takes 2 hours to collect all the samples in your house, and it takes somewhere around 2 months to get the results back. And we thought, my God, all these people that need to be testing their homes, and they need information like yesterday. We did a whole bunch of research, which I'd love to tell you about in another time, but did a whole bunch of research, and we came up with this idea about a lead screening kit. So it's not to replace that gold standard of bringing the machine to the home, but rather, can we give moms and dads some information within the next 2 weeks of completing this kit, which is exactly what we do. So St. Joe County Department of Health, I already told you what they do. The lead remediation program that the city does, uber important, because this is money for families who are income eligible to get their homes repaired. And this is kind of cool because we've had now, of course, many families who've gotten their homes repaired, and these are a couple of quotes from families about having gone through the program, having gotten the monies, having worked with a certified lead removal contractor to make their home lead safe. And they've been very happy, and peace of mind. And this is the kinds of things that keep you going day to day, for sure. And then this is us with the lead screening kit. As you can see along the lower part of your screen, we collect 3 soil samples, 2 paint chips, 3 dust samples, and we're working on our own water test as well. But by collecting these things, you as a homeowner will learn so much more. You will understand where the hot spots are in your home. And inside that little kit, you get all the things that you need to collect the samples. We pick them up, you return them to Notre Dame. We test it in 2 weeks. You get an electronic report in your mailbox, in your email, and it lets you know what's happening. And it's super easy to read. It's all color coded on a sliding scale. So if it says green, you're good to go. If it's yellow, it means it needs to be monitored. And if it's red, it means we need to do something. And in those results, we include, if it's red, we help you figure out what you need to do next. So you're not alone in this, because it can be overwhelming, no doubt. So some of the key takeaways are that there is no safe level of lead, none. We should not have it in our bodies. So sometimes you will still hear health providers say something like, oh, they just have a little bit of lead. That's not part of our language anymore. That's how we used to talk 20 years ago or so. But CDC, the WHO, NIH, all American Academy for Pediatrics, everybody, it's unequivocal. No safe level of lead. The good news is we've had lots of policy changes so that we can protect our kiddos better. And what we need is more active engagement to help those families and their children to get the kiddos tested and to get their homes tested. So what are some of the next steps? So on your right-hand side, you'll see that there's this, what we call a RAC card, and it's 2-sided, and we have them in Spanish and English, and it describes the three bodies who are providing services. So Department of Health, City of South Bend, and us, Notre Dame Innovation Team. And there's a QR code there that helps parents to get to what they need, right? And so when I'm speaking to groups such as yours, what I'm asking for is your help in disseminating that information. I'm going to share this presentation with you guys so that you can share this presentation with other people. I'm also happy to provide the PDF for that RAC card so you can send that out to your membership so that they have as much information as possible. It doesn't do any good to sit in my office or sit on my computer. Everybody needs to be hearing about this information. And then I challenge you, I don't know why all those things say 111. Anyway, is having conversations among yourselves and the leadership of your group to say, do we have a role in this? Do we have a role in lead poisoning prevention? And what is that? What could we be doing differently? How can we be helpful in this? And then finally, if you would like to join us on Lead Affinity Group, or you know somebody who is operating in this space, somebody who's been affected by it and would love to feel supported but contribute to this, reach out to Kathy Schuth. She's our director at the Near Northwest. And then, of course, if there are additional presentations where you think it would be helpful for me to do a presentation and teach people about lead poisoning prevention, I would be happy to do that. So that concludes my presentation. I moved very quickly because I wanted to keep it short, because I find that the discussions are usually the rich part of this time together. So hopefully we can open it up, Pam, to have a discussion with the folks that are online.
Oh, thank you very much for all of this. Do you want folks to just raise their hand? Do you want them to put it in the chat? What? We do have a few questions in the chat that we can go through first.
I will start at the top there. Is it possible to partner with the school system to have every child tested every year? Awesome question. Ruth Warren and I worked on a policy for the South Bend schools and actually got the board to accept the policy that stipulates that when nursing is verifying immunizations, childhood immunizations for pre-K requirements, lead testing is now part of that. The downside of that is we passed that right when COVID was happening. So that was early 2020. So we are just now revisiting the policy to get that enacted with South Bend schools. So it's an excellent question, and we should be treating that as a safety net, right? Because we need the kiddos really tested at 1 and 2 years old, because we don't want them sitting with that lead inside of them for 2-3 years. But it's an excellent safety net, and it gets us all thinking about lead poisoning prevention. Increase understanding narrative. Oh gosh, thanks, Elizabeth, for your question. My understanding is that families were having problem. Oh my gosh, to qualify, is this a problem? If so, what needs to change? This is an excellent question, and I just met with somebody who's going to help me with this week. She is the executive director of Green and Healthy Homes Initiative out of Baltimore, Maryland, and she has been working on lead poisoning prevention for 20 years, and they're at the national level. And she has connections directly into HUD, EPA, and Congress. And so when she and I met, I talked about this inane amount of paperwork that families have to provide in order to prove that they are income eligible, even though they are already receiving services that indicate that they are in fact income eligible. It's bureaucratic bullshit is what it is. And so we're going to get that flipped. So stay tuned. I hope to be able to report that we're going to get that change real soon. John asked, shouldn't the private sector be involved? Real estate landlords, can they rent, sell unknown lead-free units? Yes, yes, yes. The private sector should be involved. 2 weeks ago, I presented to the South Bend Area Realtors Association. There were 25 people there, realtors, and it was a fantastic discussion. And they were as concerned as we are about passing on homes that have lead and knowingly selling them to people who have young children, right? And what that means. So we've got them involved. It doesn't mean that we've solved the problem by any stretch of the imagination. Landlords overwhelmingly want to do the right thing, but as you well know, there's always a handful of bad actors, and we've got problems with that. And so this is where we've been working with the city on the rental safety verification program. The rental safety verification program came about as a result of the advocacy work that our community coalition did. And the rental safety verification program is about requiring landlords to prove that they have safe and healthy rentals before anybody rents. Because right now, what happens is it's the reverse, right? If there's a problem in an apartment, a mom or a dad have to come forward and complain to the landlord like, hey, something's wrong. Well, what we're hearing is that there's always a threat of eviction, right? And with as tight as our housing market is, nobody can risk getting evicted out of their home. So it's this horrible I want to use some slang to describe this because it's a horrible thing. Parents are caught up in this, and that something could be wrong in their apartment, and yet they can't do anything because there's nowhere else to move to. So RSVP is under the jurisdiction of the city of South Bend to require landlords to prove that they have safe and healthy housing. We had to go through an RSVP 2.0 because the first version didn't have enough teeth to it. So we're in 2.0, and the city council has taken up that mantle and created RSVP 2.0. They now have 4 code enforcement inspectors that are dedicated just to RSVP. So this is an excellent question, John. We are absolutely working in this direction. And might I also say, we weren't paying attention to this prior to 2017. All these things, right? So a policy that we have at South Bend Schools, a new policy statewide, the new monies, having RSVP, these are all things that have come about post 2017. Ellen asked, do you recommend that all daycares be checked as well as family care? 100%. The state is working on this. I think that was some legislation that failed, but the statewide NAACP is planning on putting this in front of the State House again this spring. Gary Holland, who is a director for the NAACP, is actually going to be speaking at our lead partner meeting that's coming up in 2 weeks, and he's going to be speaking directly about this. So yes, we're following up on it for sure. Can you put the rec card in the chat? I will make sure that I do. Yeah, my new favorite phrase. Me too, Elizabeth. Hi, Cynthia. My question is regarding the Health First Indiana law. Will the Lead Affinity Group need to apply to be a community partner to the health department in order to continue the South Bend Department of Health portion of funding for this program? LAG has already been a partner with South Bend DOH for years. So Cynthia, I'd like to hear more about what you're thinking in terms of what do you think LAG could, I suppose we could apply for those funding. So for folks who might not know Health First Indiana is historic funding for the state of Indiana. The legislators passed a law to invest hundreds of millions of dollars into the public health infrastructure for the state of Indiana. So St. Joe County is going to be receiving in the first year up to about $4 million. And in the second year, they're going to get up to about $8 million. This is historic because for decades, the legislators have been defunding and divesting from public health. And for the first time, the business community is actually coming down on them to say, listen up, you don't have an educated workforce and you don't have a healthy enough workforce for us to continue to either expand our business here or to even start a new business here. You may have heard that Eli Lilly wanted to build a whole new facility in Indianapolis and ended up pulling out and taking all their hundreds of millions of dollars and putting that business over in North Carolina because we did not have the workforce that could support what it is that they wanted to do. So under duress, the legislators have created this bill. They're investing hundreds of millions of dollars into public health. And so Cynthia is suggesting that perhaps the Lead Affinity Group could be applying for some dollars to support that community coalition. I mean, that's a really good idea. We've been a volunteer coalition all this time. We haven't had funding ourselves. And yes, we've been partnering with the Department of Health all of these years. And of course, most of you know that. I mean, I was on the Board of Health for 7.5 years, so I have a very close relationship with them and so forth. So that is something for us to think about, Cynthia. And if you have more to say about that, please email me and let me know. Any other questions? You could just take yourself off of mute if you want to and ask any other questions.
I just think this is such a great example of what concerned citizens can do if they really study the problem, do the research, build a strong coalition, and stay dedicated to a cause. It also shows some of the frustrations and struggles and how messy democratic action is, but it's wonderful. I mean, just to see this example of what citizens can do to just make sure that this issue is addressed. And I applaud you and all the members of the group for doing this and also setting this example for people who might be concerned about other issues to stick with it.
Elizabeth, thank you for saying that. This, no doubt, this has become my passion, lead poisoning prevention. You know, it all started in you know, our spare time. That's how this all happened. And we were all concerned about these kiddos. And all I kept thinking about is that if I was living in a home before 1978 and I didn't have the means and I had young children, I sure as hell hoped that somebody else was looking out for me. And that's sort of the lens that I've always looked through. And that's why I won't let go of this issue. Um, Kiddos, they come home from the hospital. They come home from the hospital, and unbeknownst to them and their moms and dads, they can be ingesting lead dust and so forth. And so, yeah, we're nowhere near done, but we have made terrific progress.
Also, don't forget the grandparents.
Right. Yeah.
The grandparents often or major, their children spend a significant amount of time in those homes. So some of us don't have to worry about our kids anymore, but our grandchildren are precious.
Right. I also have to give a shout out to Linda. Linda's been part of Lead Affinity Group for many, many years and also helped set up this presentation. So really appreciate that, Linda.
What do we know about the socio-demographics of people who are not willing to come forward and have their homes tested?
What do we know about the socio? Okay, so the folks who are not willing, it's often not a question of not willing as much as it's that they don't know, right? And it's often competing priorities. We're talking about families that are, you know, often living in poverty, low resources, right? And then that's competing priorities. So I might have two jobs and then my car might be out of gas, or I have a flat tire this morning, or the kids are struggling at school, or I've got to put food on the table. And so getting the home tested just keeps getting pushed down the list. And what we have to do as a society, as a community, is raise that level of awareness and say, this has got to be at the top of the list, because your kiddo is being affected every single day when they're in the presence of lead, and it directly affects their IQ, which interferes with their cognitive ability and their God-given gifts and talents are being reduced right then and there because of that lead poisoning. So they don't even have a shot if that's what they're being exposed to. And so this is why it's got to be at the highest level that we have to be putting a priority on this and making sure that we're protecting kiddos literally as soon as they're coming out of the hospital. I'm writing a proposal right now where I'm going to be working with Beacon Community Impact on working with pregnant moms, educating them, putting the kit in their hands so they're testing the house before baby comes home. So we're going to do it, and we're going to do it in two different ways. They have a community health worker model where they go out into the home to help moms, pregnant moms. And so the community health worker is going to do it that way. And then we're going to try it a different way with WIC and the Babe Store, where they do, education classes. And we're going to give moms the kit, and they will also get an incentive to complete the kit. So Babe coupons are like money. And so we will incentivize them by giving Babe coupons, and then they can turn those in for all kinds of things to help them when the new baby comes home. So we're still trying new ways of getting people's homes tested. So good question, John. Yeah, Ellen. Hi, Ellen.
How many homes have been remediated since you started this this committee. That was a big issue at the start of COVID. There weren't many contractors that were state certified to do the work.
Right.
And so what's been possible since the
Yeah.
beginning of the program?
Ellen, it's a really good question. And as you might imagine, it's still a challenge. We do not have certified contractors in St. Joseph County. We have to go outside of St. Joe County to bring in those specialized services to get those homes done. It is still slow going. It is way better than when we first started. I think the first 2 years that we had that HUD grant, we might have completed 2 homes. We are now in the 20s that we've completed the homes. But if you think that in St. Joe County, we have 68,000 homes that were built before 1978, fixing 20 homes is just a blip, right?
Yeah.
It's just a blip. Those are just one-offs. We've got a long way to go. The other thing too is we have the HUD program director just left that position. Her name was Kristen Titus, and she really helped. She really got more engaged and really started to be out in the community and talking to families and helping them through the process. The city has identified a new person. That person is in that space, but is brand new to lead poisoning. So we've got a bit of that learning curve again. And so it's going to be, on all of us, and I'm speaking largely about the Lead Affinity Group, to support that individual and get them up to speed. But we're also looking for outside resources to bring in to train that individual. And I would argue too that it needs to be more than one person. I feel like there needs to be a team of people who is working on this. And so we'll get there. And maybe I should be thinking about Cynthia's thought about applying for monies. Maybe the city could apply for monies so we can ramp that up. So we can.
She has another question too.
Yeah.
Cynthia does.
Oh, do you have any updated numbers regarding
Yeah.
high lead levels in the Northwest? How are lead levels tracked? Yeah, any updated numbers? So let me say this. We have not had access to, let me back up. In 2017, when we started on this journey, what's the first thing academics need to do is we need to study the data, right? And understand where the lead problem is. And so at that time, with that health officer, we signed something called a data agreement between Notre Dame and the health department. They shared 10 years worth of data. So we were able to do a real deep dive into understanding lead in our community. And we published that information. We're in a different time now with our county government, and I was told last week that data agreement was dissolved, unbeknownst to us. So I don't have updated information on those lead levels for those neighborhoods, and it's something that we need to talk about, and it's something that we need to address. But it's very alarming to hear that data agreement was just dissolved with no conversation. And the truth of the matter is that while our health department does some really amazing work, there's rarely a health department in the country that has the capacity to be able to do that type of data analyses, right? So I have a very good relationship with the new health officer, and we are going to be talking about those things.
Who owns the data now?
Who owns the data? That's the Department of Health owns that data.
Well, Heidi, I have a question. What if there is a home that's built after 78, but it's in an area where the water has lead in it? Does that happen? Yeah.
Is that what you're asking? Yeah, does it happen?
Yeah,
We've not found that to be true. So there's a couple of things there. One is Notre Dame Lead Innovation Team has done some water testing themselves. We have never found an elevated level yet in St. Joe County.
Water.
City of South Bend does routine water testing, right? Residents can send their samples in and get them tested for free. And they do find sometimes elevated levels. the third thing is that the city of South Bend also has a third party test their water regularly, right? The municipal water, to make sure that it is lead free. What we're finding is that it's the service line that's problematic. So the line that goes from the water source and comes through the neighborhood, that's called the main. The service line is the line that connects to the main and takes it to the person's home. And then that's where the problem can sometimes be, right? So it's not likely that a home that was built after 1978 would be hooked up with a leaded pipe, right? So that's
If they drill, if they have a, but if they have a, if they drill, you know, if they're outside the city limits,
if they're
there's
outside.
probably not a problem with the water.
Not
If they-
likely. Not
Okay.
likely. But let me also say this. So South Bend schools, this was about 5 years ago, they found lead at some of their schools, and they went through this extensive process to replace pipes and so forth. And then they went for the clearance. And in some cases, they still found lead. And it was befuddling. We were like, what the hell? Like, how is this continuing to happen? And what we learned is that certain faucets that are made outside of the United States
Oh.
have components that contain lead on the inside of them and that can be leached. And so we have to pay close attention now to what fixtures are we buying? And are we assured that the fixture that might be made in China or elsewhere does not contain lead? So it's amazing. Somebody said earlier, maybe it was you, Pam, who, you know, this is a complex public health problem. And, you know, now I have to worry about even buying a faucet that's sitting at Home Depot, right? It's so multifaceted, and it's just important that all of us get really up to speed and educated about this topic, so that when we hear it, we get to contribute in a really positive way, right? In an educated way, and getting people up to speed on what it's going to take to solve this problem. Because if this was an easy one to solve, it would have been solved, right? But this is hugely complex, hugely complex. We need government, we need legislation, we need community-based organizations, we need families, schools, hospitals, providers. Everybody has to be firing together to be able to solve this problem. But that's what we're working on. That's why we're talking to you all, and we're on this mission to solve this public health problem.
Okay. We are nearing the end of our hour. And Dr. Bettinger, you are wonderful. All the information is wonderful. There are so many people. Well, I don't know about everybody else, but there are a lot of that I didn't know about. So I'm sure that other people also didn't know about, not just the issue we might know a little bit about, but not what we're doing and how to get involved.
Yeah.
So
Exactly.
thank you very
Exactly.
much for all that information. And if you could put that rack thing, the rack card information in the chat so people can copy that and use it.
Would it be all right if I email it to you?
You
I'll
could,
email
that would be
and
wonderful.
I'll email the presentation, and then you can send it out to folks. And then it
That's-
also has my contact information if anybody, you know, like I said, if you identify or you're part of another organization, Elizabeth, I'm thinking about IUSB, you know, is there an opportunity for me to come and present to another group? I would be happy to do so.
Could you present also like to an organization in Elkhart?
Absolutely.
Or is it just South Bend?
No, you know, well, you know, I think, you know what? I would just want to have that conversation with the folks from Elkhart, because this is kind of St. Joe focused, but
Okay,
there's a larger issue here. And so I would probably just modify the presentation so that it's not uber St. Joe focused, but rather
Right.
just pull that lens back a little bit to make it useful for them as well.
oh, there's some new messages.
Have you
They're
been,
probably saying you're wonderful.
Thank you, guys.
have
Thank
you
you.
been on
I've enjoyed
Elizabeth?
being with you. Thank you. Thank you.
Thank you
Feel
so
free to
much.
reach out.
Okay,
Bye.
thanks a lot, Dr.
Bye,
Bettinger.
thanks.
All righty.
Bye.
Bye-bye.
And thank you all for coming. Bye.
Bye.